Today we are going to discuss about the comparison of systemic versus musculoskeletal pain pattern, which is a very important topic. And in this topic we'll discuss onset of systemic pain, musculoskeletal pain, description, intensity, duration, pattern, aggravating factors, relieving factors, associated signs and symptoms. How systemic pain is different from the musculoskeletal pain. Let us discuss about the onset of systemic pain and how is it different from the musculoskeletal pain. In systemic pain, the onset is sudden. If we talk about musculoskeletal pain, it can be sudden and gradual. Sudden, for example, it can occur as a result of trauma. It can occur as a result of any stress. It can also occur as a result of side effect of some medications. Gradually, it can occur as a result of chronic overloading of some part of the muscle. So, musculoskeletal pain can be sudden and gradual. When we talk about description of the systemic pain, it is usually unilateral, bilateral. And if we further describe the pain in case of systemic, it can be knife-like, it can be cutting, it can be throbbing, there can be bone pain in case of cancer, for example. And if we talk about musculoskeletal pain, it is usually unilateral. And with unilateral pain, there can be some stiffness that can present in a patient after prolonged rest. And pain can also increase after stressful activity. So we can describe the musculoskeletal pain in terms of cramps. We can describe it in case of muscle ache. Local tenderness to the pressure may also be present in case of musculoskeletal pain. Duration of systemic pain is usually constant. It awakes the person at night, for example, in case of tumor or cancer. And if we talk about musculoskeletal pain, it can be modified by rest or change in position. Let's talk about pattern of systemic pain. It is usually gradual, progressive, cyclic nature of the pain. Night pain can also occur. For example, in case of cancer, there can be a night pain, which is gradual, progressive, cyclic nature of pain. Let's talk about kidney pain. Any stone in the kidney can also result cyclic nature of the pain or pain that occurs in the form of waves along with fever. So if we talk about musculoskeletal pain, it can be modified by changing position, or it can be modified by movement. For example, there can be restriction in active passive movement or accessory movement in case of musculoskeletal system. If we talk about aggravating factor in case of systemic pain, it is always organ dependent. For example, in case of esophagus involvement, eating or swallowing can affect the symptoms, can make it worse. Same like this is heart. If there is any pathology that is related to heart, then cold, stress, exertion, heavy meals can also aggravate the symptoms. If we talk about GIT symptoms, peristalsis affects the symptoms. And if we talk about musculoskeletal pain, symptoms are altered by rest or change in position. Usually by rest, the symptoms are relieved, and symptoms aggravate by change in movement, aggressive movement. Relieving factors of systemic pain also depends upon organs, different organs. If we talk about gallbladder symptoms, they are basically relieved in leaning forward. If we talk about kidney, symptoms are relieved by leaning of the affected side. If right kidney is involved, if a patient lean on the right side, then symptoms will decrease. If we talk about pancreas, symptoms will relieve in sitting position or upright position. Leaning forward may reduce the symptoms. Similarly, with pericarditis, symptoms they are relieved by changing position, like leaning forward, kneeling on four limbs, sitting upright can relieve the symptoms in case of pericarditis. If we talk about musculoskeletal pain, symptoms are reduced or relieved by rest or change in position. Associate signs and symptoms in case of systemic pain can be fever, chills, sweating, bowel bladder symptoms, headache, dizziness, and if we further discuss other symptoms, there can be skin lesions, there can be diaphoresis if it is related to heart. There can be weight loss, nausea, vomiting. It can be related to GIT symptoms. If we talk about musculoskeletal pain, usually there is no associated sign and symptom. However, stimulation of trigger points can cause sweating, nausea, and even belching. Let us discuss an example. For example, joint pain. It can occur as a result of systemic musculoskeletal pain. How you will differentiate joint pain is related to systemic or joint pain is related to musculoskeletal pain. So symptoms will tell us whether that pain is systemic or musculoskeletal. We'll discuss clinical presentation, past medical history, associate signs and symptoms. It will tell us whether that pain is systemic or musculoskeletal pain. For example, if we talk about clinical presentation, if a patient comes to you with systemic pain and he talks about awaking at night, throbbing pain, constant cyclic nature of pain, या pain that is progressive in nature, that will be related to systemic pain. If he tells you about pain that decreases with rest or that pain reduces with changing position, that is related to musculoskeletal origin of pain. And there's also if restriction in range of motion or restriction of accessory movement that can also occur in case of musculoskeletal system. Second point is regarding to the past medical history. Any recent history of infection, hepatitis, bacterial infection, UTI, any history of bone fracture, any history of sore throat, skin rash, any history of injection, GIT symptoms, any history of presence of extensor surface nodules, all indicate systemic origin of joint pain. And if this history is absent, that will most probably indicate musculoskeletal origin of pain. And we'll also see joint pain regarding to the associate signs and symptoms. If joint pain occur along with skin rash, weight loss, fever, and also proximal muscle weakness, distal muscle weakness, ascending paralysis, it will indicate a systemic origin of pain. If there are none associate signs and symptoms, however, you will check for the trigger point. Trigger point can result in pain and can be accompanied by nausea, sweating. It can be related to musculoskeletal origin of pain.